Hello everyone. Today topic going to deal the topic is the drug levels in the blood. Yeah, after the administration, what are the different levels that will be experiences in the blood by the drug is the today topic, which can be also said to be the topic as plasma concentration time profiles. Yeah, before going to the drug levels in the blood and as well as the plasma concentration time profiles, how that what are the parameters that will be involved. Before going to that, let us have some idea regarding that how the drug will be get experienced. What are that responses that can be experienced by the drug in the blood. Commonly, once the drug will be administered, the drug responses relationship can be explained by the two responses. First one is the dose response and as well as the time response. Here what will happen, depending upon the dose, the response will be varies. That means the maximum dose will be given maximum pharmacological response and minimum dose will be given minimum response. Apart from that, it also be depends upon the potency. You can't simply say that maximum dose, maximum pharmacological action, depending upon the type of the dosage regimen and as well as depending upon the characteristics of the drug, the dose response will be the dose that we use to be administered will also be varies. And second thing is the time response. If the maximum time spent by the drug in the body will be more and more, the pharmacological action, the clinical therapeutic effect will also be more. If the lesser effective, that means so that whatever the drug it is having, simply you can say elimination half-life is within the shorter period of the time. That indicate the drug will be eliminated away from the body very fastly. That indicates what it is indicates that spent by the drug will be maximum time will be there and thereby maximum pharmacological response. And whole responses can be better explained by the relationship between the time, dose and the response curves and as well as the time and the response curves. Here if you see, this is the diagrammatic representation with respect to the time and clinical response curve. If the time, how the time the drug spent by the drug, time that spent by the drug versus time response. If you see, this is the time on the x-axis and y-axis clinical response or otherwise the pharmacological effect or the clinical effect you are taking. Here in the initial stage, what will happen, there is no clinical response. Why? Means it has to be passed through many pharmacokinetic parameters. That means first thing, absorption has to be takes place and after that it has to be distribution. If the drug is mean the characteristic is undergone the many dispersion process, undergone that metabolism also, then only it will be gives response. Here that whatever that stage will be, that let us see the clinical response. That means there is no clinical response at the initial stage. But here what will happen, as the time is proceeds, as long as the time spent in our body will be more and more increases, the clinical response will also be increases. If you see, slowly that response curve is increases here from to here, whereas that wherever that response, maximum response is shown by that at that time, it is said to be that maximal effect or the maximal clinical response, and the respective time respective to that clinical effect is said to be the Tmax. And overall the time that is responsible to give that pharmacological effect is said to be that particular duration of action. Duration is nothing but with respect to the time. That means the time, the first one is after the drug will be administered into the body, that two responses will be given. First one is the depending that response, clinical response or the effect will be completely depending upon the two major parameters. First one is the dose and second one is the time. This is the time response relationship where time is taken on the x-axis and y-axis clinical effect and as well as the response, clinical response will be take on the y-axis. So only thing, initially there is no clinical response and here slowly as the time spent by the drug in the body will be proceeding, it will be slowly increases, clinical response will be increases at that particular point of time. It will shows the maximum response which is said to be the peak effect or otherwise the maximal effect. And here that particular the time with respect to this maximum maximal effect is said to be the Tmax. And as well as the time which is responsible to give that whole time, that entire time that which is responsible to give that pharmacological effect or the clinical response is said to be from here to here, it is said to be the duration of response. That means within this time, let it be take it is the 2 minutes, it is the 3 minutes, 4 minutes or 10 hours, like that if you take, that means initial point from the 2 minutes to the 10 hours, that after the drug administration, after the drug enters into the body, from the 2 minutes to the 10 hours, the drug is responsible to give its clinical response. And here another type of the curve only. Sometimes depending upon the route of administration, sometimes what will happen, as soon as in the shorter period of the time, the response will be obtained. In the, that means initially if you take the drug will be administered in the IV route. Initially the starting point itself, the drug will be shows its clinical response. And sometimes what will happen, after some time that particular clinical response will be obtained. In some cases, some lot of lag period, after that lot of lag period, that particular clinical response will be obtained. And next one is the dose response relationship. What is the dose response relationship and for what purpose it will be responsible? Here two parameters you need to consider. The dose will be responsible for the two parameters, or the potency and as well as the efficacy. What is the potency? In some cases what will happen, if you take cardiac drug, digoxin, even 2 mg is enough to give the pharmacological action. In some cases 100 mg, in some cases 200 mg, depending upon that minimum and the maximum dose. The dose while designing the tablet or appropriate doses from recipe will be differentiated. That means what is the potency? The absolute, the accurate amount that is required to produce that appropriate pharmacological effect is said to be the potency. As I discussed earlier, simply in some cases only 2 mg will be responsible to give that clinical response. In some cases what will happen, larger quantity, larger amount of the drug is responsible. Here you need to find the dose is depending upon the characteristics of the drug and characteristic, and as well as the type of the patient, whether you are designing the dosage regimen to the patient or the patient with respect to the age. In some cases infants, in some cases elders, some cases geriatrics you are giving. That means the dose will be with respect to the drug characteristics, it will be changes, and apart from that it will also be changes with respect to the patient age also. Here what is the potency means? Amount of the drug that required to produce an particular clinical effect. And more potent drug, it will be require say minimum or the lower dose to cause that same effect. What is the efficacy? Efficacy is the maximum response that produced by the drug. In the previous graph I have explained here, this is that particular efficacy. The maximum effect that shown by the drug is said to be that particular efficacy. And here potency is nothing but with respect to the amount of the drug that will be capable to give that pharmacological response, and the dose of the drug or the amount of the drug which will be responsible to show the maximum response to produce a drug is said to be that particular efficacy. And here these are the two dose response curves. This is one curve where it is plotting that previously you are plotting the time response curve, where the time is taken on the x-axis and clinical effect is taken on the y-axis. Here if you say, since it is the dose response relationship, y-axis it will be takes pharmacological effect and x-axis it will be plotted with the dose response. Here you are plotting by considering the two types of that particular therapeutic activity or the therapeutic effect. Here A, which shows that the drug which has the lower threshold within the low quantity of the dose, with the minimum dose it will be possible to give that it is capable to give that therapeutic activity. The graph is shown by the curve A. Whereas what is the B means, which has a clinical maximum effect. It, in order to give some drug which is responsible to give that pharmacological effect with the maximum dose. If you take, this is with respect to the 10 mg or the 2 mg. If you take, it will be requires 100 mg like that. That means as the in some cases what will happen, these are the two examples, and apart from that some cases means what will happen, irrespective to the dose, that means if you are taking the digoxin, which will have the 2 mg, if you are taking paracetamol, commonly 100 mg or the 500 mg you are administered, that pharmacological response will be same in that case. That means these are the two dose response relationship, where A will be shows that which has the lower threshold will be there, whereas B is having a greater maximum effect. And here, why you are going through these drug levels in the blood or the plasma concentration time profile? What is the purpose mean? What is the main objective of any drug therapy or the administration of the drug, of the optimal drug therapy is to provide a maximum therapeutic effect with the minimum toxic effect. Commonly, what is the main motto to give any treatment to the patient? To treat some disease. That means not only to treatment some disease, in order to give the maximum therapeutic effect in an optimal time with a minimum toxic effect, you are giving that maximum therapeutic effect. As in the similar manner, if the maximum toxic effects or the side effects will be arising with the same patient, there is no use. In order to say the drug therapy which you are giving, that it is, in order to prove that it is the optimum, the drug should be capable to provide a maximum therapeutic effect with a minimum toxic effect. But here both the maximum therapeutic effect and as well as the minimum toxic effect, both are depending upon the concentration of the drug at the site of action. Simply you can say the concentration of the drug that present in the blood or the plasma, which is difficult to measure. We can't simply by seeing the visualization or by seeing with the naked eye, you can't say that this much of drug is present with respect to that time. That means for the 5 minutes this much microgram per ml is there, for 6 minutes this much, you can't say. Here ideally it is highly impossible to direct measurement of the drug concentration in the blood. But here both the maximum therapeutic effect and as well as the minimum toxic effect, both are the parameters which are responsible for proving that the drug therapy which you are giving to the particular patient, proving in order to prove that it is the optimal therapy, that both the effects will be depending upon the concentration of the drug at the site of action, or simply you can say concentration of the drug that present in the plasma, and which is owing to impossible to owing to measurement is difficult. And here both the rate and, whereas instead of taking that plasma concentration time profile, you can directly determine that you can consider another parameter which is having that amount of the drug in the plasma. Why means, as the direct relationship is exists between the concentration of the drug and as well as the amount of the drug in the plasma, you can consider the, instead of taking that concentration which is difficult to measurement, you can consider the another parameters which is that amount of the drug that present in the body. And here the rate and extent of the drug absorption is better explained by using the plasma concentration time profile. Here that whole thing, that means whatever the parameters concentration, both are depending upon the amount of the drug in the body, which is highly impossible to directly measurement, is highly impossible to measure. Instead of taking the amount of the drug present in the body, you can consider the another parameter which is the concentration of the drug in the body. Here that means why you are taking, how can you take that, instead of taking amount of the drug in the body, how can you take that concentration of the drug in the body? There is a direct relationship is exists between the amount of the drug in the body and the concentration of the drug in the body. And whole this, whatever the rate and extent of the drug absorption, with what rate, with the amount, what amount the drug absorption is takes place, is mainly depending upon the concentration with respect to the time. Both the parameters are better explained by the profiles commonly known as plasma concentration time profiles. How can you plot these plasma concentration time profiles, and what are the different regions that can be observed in that particular plasma concentration time profile? These, how can you plot these profiles? Mean these profiles are obtained by measuring the concentration of the drug in the plasma say a sample. Simply, they say how can you determine means in simple words you can say first of all that particular drug in the appropriate dosage form has to be administered to the patient, respective patient. The samples has to be withdrawn at the various time intervals after that administration. Now coming to after the samples has to be taken and measuring that appropriate respect to concentration has to be measured with respect to the time interval. Now you have two parameters, one is the concentration parameter with you and second one is the time parameter. How can you plot these plasma concentration time profiles? Means simply by taking that whatever the time parameter on the x-axis and as well as the plasma concentration time data onto the y-axis. Only the name itself it is explaining that plasma concentration time profiles, which is also called as plasma concentration time graphs or the curves. Only thing by taking concentration onto the y-axis and as well as the time on the x-axis. Concentration, how can you measure means after the administration of the drug, the samples has to be withdrawn from the patient through the appropriate channel and then with respect to that various time intervals, and after that plotting a graph by taking time on the x-axis and as well as the plasma concentration onto the y-axis. And here once that particular plasma concentration time profiles are plotted, what are the different parameters that can be explained under these plasma concentration time profiles? Mean as long as the drug reaches that general or the systemic circulation, once the drug will be administered, if it is the IV route directly enters into the systemic circulation. If it is the subcutaneous route, if it is the muscular route, it will take somewhat distribution will be delayed, distribution will be takes place. Whereas the absorption whereas when the drug is administered in the oral route, already you know what are the four pharmacokinetic parameters that can be experienced: the absorption, distribution, metabolism and the excretion. Whereas that particular apart from the absorption, remaining three parameters combinedly called a drug disposition, where from the point where it trends to that particular declining in the plasma concentration is takes place, and combination of that metabolism and excretion combinedly called as drug elimination. It is the point where trends to removal of the drug. That particular point there is a lowering in that particular elimination will be processed. That removal of the drug away from the body will be started, and once the drug will be reaches the systemic circulation, plasma concentration time profiles will be rises very slowly and rises up to the maximum level. Usually absorption is more rapid than the elimination. Out of the four parameters, absorption, distribution, metabolism and the excretion, here absorption is more commonly that parameter which is considered as more rapid than the elimination. And as the drug is being absorbed into the systemic circulation, first of all that absorption will be takes place, followed by what will happen once the entire drug will be enters into the systemic circulation, that followed by the distribution to the all the tissues, and it will be binded with the different body components, and once that equilibrium it will be attains, it will be gone through the another remaining through processes combinedly, which is said to be the elimination. That means initially it will be passes through the absorption step and then distribution, and simultaneously it will be eliminated through that elimination process, which is the metabolism and the excretion. And here the elimination if the drug is proceeded by the excretion and the biotransformation or the combination of the both. First of all the drug will be absorbed into the systemic circulation, which is the blood is that particular source. And finally that removal of the drug or elimination of the drug either be takes place only through that particular excretion or biotransformation, or sometimes the combination. Once the drug is get eliminated through the some of the drug is eliminated through the liver and remaining will be eliminated through that particular excretion, or in some cases combination of the biotransformation and excretion will also be takes place. And this is the one plasma concentration time profile commonly that followed by after the administration of the oral through the drug is administered through the oral route. As I discussed earlier, that particular as it is the oral route, that absorption process will be lag period will be more and more will be takes place. If it is the IV route, immediate concentration, entire concentration will be enters into the systemic circulation. But here I have mentioned here Generalized plasma concentration time profile, after that oral administration only. Initial some lag will be there. There is no concentration of the drug in the body will be present.